What is the Norfolk Health Department's role in mosquito control?
Unlike many health districts, Norfolk Health Department actually sits in a very good position in that we oversee the City of Norfolk Vector Control Program directly. In many other cities, that's actually fall under Public Works.
Now, as the environmental health supervisor in the Vector Control Division, what about your own role? What is your role?
So my role, even though I am with the state, we directly control the vector control program. We do any our role is to prevent vector-borne diseases to be, from being transmitted to the Norfolk population. Those diseases can be via mosquitoes, could be via animals in terms of rabies. We oversee all of that.
Now, other than that annoying sting that comes from a mosquito that decides you look like dinner, why is mosquito control so important?
It's critical because mosquito is one of those things you don't want to allow it to get out of control. Number one, it's a nuisance, like you say. Mosquitoes will bite you. Some people get very itchy from it, but that's not all. Our number one concern is mosquitoes are very good at transmitting diseases to the human population as well as pets. That is where vector control comes in. We focus on monitoring the population for vector-borne diseases.
Now, there's been a lot of conversation about Zika, and there's probably, as a result of all that conversation, some confusion. What is Zika actually?
So Zika is a virus. It's a virus that's transmitted via mosquitoes. Two mosquitoes particularly, the Asian tiger mosquito, or the Aedes albopictus, and the yellow fever mosquito, the Aedes aegypti. This virus is very unique in that not only is it transmitted by mosquito, but it's been linked to sexual transmission as well. It can be transmitted from man to a woman. It's a virus that's unique in that not always do you have symptoms of it, but even though you're not showing symptoms of this virus itself, you're still able to transmit this disease. It can be transmitted from one infected person, bitten by an infected mosquito, to the next person.
Okay, so there's the Aedes aegypti and the Aedes albopictus, which is the Asian tiger mosquito.
Correct.
Why is the Asian tiger mosquito so important in this area?
The Asian tiger is important in this area because it's present here in abundance. The Aedes aegypti is not present in this area. Asian tiger has the potential to transmit Zika, but it also has the potential to transmit many other vector-borne diseases, example Triple E and West Nile. Because of its
Triple E being Eastern equine encephalitis.
Yes, correct.
Okay.
Because of its abundance in this area, and the way this mosquito likes to live in close proximity to humans, it's a major concern to us, not only from the nuisance standpoint, but from the vector-borne disease standpoint.
So what can Norfolk residents do to protect themselves during mosquito season?
The first thing is protection. You're out and about, whether it's doing yard work, hiking, you will get bitten by a mosquito. What we advise is use personal protection. You have to protect yourself with the correct mosquito repellent. A lot of people will use repellent, but you have to keep in mind, based on the concentration of that repellent, that dictates how long that repellent is going to last. So if you're going to be outside for 5 to 6 hours, you want to make sure you're using the appropriate repellent that's going to be active for that period in time.
So with the questions that people are likely to have, we should give the number for Vector Control Division. I want to make sure we get an opportunity to give it again later, but what is that number?
So Vector Control, if you have any questions or you need answers for mosquito relation, give us a call at 757-683-2840.
One thing that I know that you guys in Vector are very concerned about when it comes to mosquito is reducing the source. That means eliminating standing water. What can you tell us about that? How do we get that done?
Our approach is to target the source. In order for mosquito to complete their life cycle, they need standing water. Mosquito will find a blood meal, but it cannot lay eggs unless there's standing water. In the case of the Asian tiger mosquito, they look for standing water in close proximity to your home. These could include things like flower pots, even a lawnmower, things that you don't think about. Toys are primary source of standing water around your home. If we can reduce the standing water around your home, hence we can reduce mosquitoes breeding. Keep in mind, these mosquitoes don't have a very long flight range. If they're breeding close to your home, chances are they will bite you because you're closest to them.
So they're pretty smart. They know where you live, so they're going to hang around where you live and get in all these places where they can breed. Another question I'd like to ask you is about mosquito fogging. As I mentioned earlier, I remember as a kid, mosquito fogging trucks coming through the neighborhood. What can you tell us about mosquito spraying and fogging?
This is a question we get a lot, and it's a question that takes a little bit to explain. Keep in mind, when a fog truck is going down the street, as the fog is being emitted, any mosquito that comes in contact with that fog will die. It's an insecticide. There is no residual effect. It's a contact killer, meaning it will only kill a mosquito that's on the wing flying. You have to keep in mind now, mosquitoes are in your yard, in your backyard, hiding, especially this Asian tiger mosquito. They have a tendency of hiding underneath of things. Spraying is not as effective against them. We use spraying to target the vector species. You know, the species that are out and about targeting other animals and birds, and the one that can transmit the disease. However, we emphasize source reduction because spraying has very limited effect on mosquitoes that, for instance, in your yard, breeding in your backyard.
So what kind of services does the Vector Control Division offer?
We offer you the ability to come to your home if you have a mosquito problem. We will do an inspection of your yard. We will do an inspection of the surrounding area. 90% of the time, we can pinpoint the source of where these mosquitoes are coming from. We can provide you with education as to what you can do. There are instances where water sources cannot be removed, in which case we can provide you with the necessary treatment to treat that source so you can prevent mosquito breeding.
So a lot of what you're talking about sounds like surveillance. Is that not correct? What is surveillance? What is one of the services?
Surveillance, we have a very extensive surveillance program. That is, we have about 160 sites around the city where we trap on a daily basis and monitor the mosquito population. We take these mosquitoes back, we can test them for the relevant Eastern equine encephalitis and as well as West Nile virus. We also monitor the population so we know how to respond. When we see areas where mosquito populations are spiking, we can direct our team to get to these areas so we can focus our source reduction to try to reduce populations that are blooming in specific areas.
Okay, you talked earlier about going into the Norfolk Public Schools. You guys have a program that is used to educate children. What can you tell us about that program?
This is a very unique program. It targets around this kindergarten, maybe 5-year-old to about 7. At this time in their school life, they're learning about insect life cycle. What we do is we introduce them to the mosquito life cycle and things that they can do to help prevent mosquito. One unique part about this program is that we expose the kids not only to the literature about mosquito life cycle, but we also show it to them. We take live mosquito larvae in their class in what's called a breeding chamber. It sits in their class for a week, and not only do they get to look at the book and read about mosquito larvae, they actually see it happening right in front of them. And that's a powerful message because when they see that, it's embedded in them. They can take that home, share it with their parents, and I think we're getting very positive feedback from it.
Well, that sounds like a very great and dynamic program.
It is.
Okay, let us get the Vector Control Division number again.
So call us if you have any questions, and we will gladly provide you with as much education or even come to service you. And that number is 757-683-2840.
757-683-2840.
Yes, sir.
George, I want to thank you so very much for coming on to talk about all that you do in Vector and with mosquito control, because I'm sure folks have a lot of questions, particularly when it comes to Zika. Thank you so very much.
You're welcome.
And of course, we want to thank you for joining us for this edition of Health Watch. Remember, you can always watch previous editions of Health Watch online at www.norfolk.gov/healthwatch. If you'd like to drop me a line, you can email me at terrence.affer-anderson@vdh.virginia.gov. Of course, you can always call me at 757-683-8836. That's 757-683-8836. For the Norfolk Department of Public Health, I'm Terrence Affer-Anderson, and this has been Health Watch.